For the last 30 years or so, if you had an acid-related problem like GERD or an ulcer, chances are you were handed a prescription for something called a PPI. It was the gold standard. But what if that gold standard isn't so golden anymore? Today we're going to talk about Vonoprazan, a completely new kind of drug that's changing the entire game of acid suppression. And look, that's a pretty bold question, right? But it's one we absolutely have to ask. After 3 whole decades of dominance, it's time to take a really close look at the reigning champion of acid control, the proton pump inhibitor, or PPI, and ask if there's a better way.
So to really get why this new drug is such a big deal, we gotta start with the old guard. We have to look at the cracks in the foundation of what we've been using for so long.
And let's be fair, they were the gold standard for a good reason. Since the 80s, PPIs have been the absolute cornerstone for treating things like GERD, peptic ulcers, and even H. pylori infections. They've helped millions of people. But as we've gotten smarter about how our stomachs work, we've also become much more aware of where these drugs fall short.
All right, so let's break this down, because this is really the heart of the problem. First off, PPIs are what we call prodrugs. That means they're inactive when you take them, and they need acid to switch them on. This one fact creates a whole bunch of issues. It means they're slow to start, taking days to really kick in. You have to time them perfectly with your meals. They can only block the acid pumps that are currently working. And to top it all off, how well they work can be a total toss-up from person to person because of our genetics.
So all of these limitations, they basically created this huge opening, a clear need for some real innovation. And that brings us to the solution, a brand new class of medication called potassium-competitive acid blockers, or much easier to say, PCABs.
The name itself kind of gives away the secret sauce here. Instead of needing acid to get going, PCABs go straight to the source. They work by directly blocking the proton pump. They literally compete with potassium to do it. It's just a much more direct and, frankly, a more elegant way to shut down acid production.
And this is the payoff. Vonoprazan is the first PCAB in this new class, and it just systematically dismantles all those old PPI limitations. We're talking rapid, powerful, and long-lasting acid suppression. And here's the kicker for anyone who's ever used a PPI, its effectiveness isn't tied to when you eat. That is a huge clinical advantage. Okay, so let's get a little nerdy. Let's pop the hood and really see how Vonoprazan pulls this off at the molecular level. How does it actually solve the problem?
This right here is the absolute core of the story. If you can grasp this one fundamental difference, everything else we're about to talk about just clicks right into place.
Okay, so look at this. It's like 2 different roadmaps. On the left, you've got the PPI. It enters the cell all sleepy and inactive, then it has to wait around in this super acidic little channel for the acid to wake it up. Only then can it go find and shut down the pumps that are currently active. But now look at the right side. Look at Vonoprazan. It shows up ready to go, already active. It gets concentrated in that same channel and just blocks the pump's potassium site, shutting down both the active pumps and the ones that are just resting. It's a total blockade. So, you can boil its action down to 3 key steps. First, because of its chemistry, it basically gets trapped and builds up in super high concentrations right where it needs to be. Second, it binds directly and reversibly to that potassium spot on the pump. And third, by blocking that spot, it stops the pump from doing its job, which is making acid. Simple as that.
So let's put them head to head. You've got an active drug versus a prodrug. Reversible binding versus irreversible, blocking all the pumps versus just the active ones. And what does that all mean? It means a super fast onset of action, you don't have to worry about taking it before a meal, and it provides much more consistent acid control, especially through the night, which has always been a major headache with PPIs.
All right, so that's the cool science, the how it works, but what does this actually mean for patients in the real world? How does all this fancy pharmacology translate into better results? Let's get to the proof.
This is a really big deal when it comes to fighting off H. pylori. You see, this bacteria is a sneaky little bug. It can actually hide out near dormant cells where the acid level isn't quite low enough for a PPI to get activated. But since Vonoprazan blocks all the pumps, active and resting alike, it creates this consistently hostile environment. There's literally nowhere left for the H. pylori to hide, which lets the antibiotics do their job way more effectively.
And the clinical trials? Well, they back this up in a big way. The data from the huge PHALCON-HP trial is pretty clear. The Vonoprazan-based therapy had a significantly higher eradication rate than the standard PPI therapy. But here's the really crucial part. This advantage was even bigger in patients who had antibiotic-resistant strains of H. pylori. The ones that are the absolute toughest to treat.
And it's not just for H. pylori. We see the same story with erosive esophagitis. Now, Vonoprazan is better across the board, but look here. When you get to the really severe cases, the LA grade C and D patients, the difference in healing rates is huge. It's a double-digit improvement in some cases. That's where Vonoprazan really shines.
So when you put it all together, the novel way it works, backed up by this really strong clinical data, it becomes pretty obvious that we're not just looking at another drug. This is a genuine paradigm shift in how we approach acid-related disorders.
So let's just recap the absolute highlights. Vonoprazan has a completely new reversible mechanism that gives us faster, stronger, and longer-lasting acid control. This makes it a total game changer for H. pylori, especially with resistance on the rise. It sidesteps all that genetic variability, so its effects are predictable. And for patients with severe GERD, it offers faster relief and better healing. It just checks all the boxes.
In the end, it's really hard to overstate how important this is. This quote says it all, really. Vonoprazan isn't just a small step up. It's the biggest leap forward in how we control stomach acid in over 30 years. After decades of relying on the same old technology, it's safe to say a new standard of care has well and truly arrived.